The biggest issue is actually lack of information, and there are there are services such as ProMed, which is run by the ISID, which give us an idea as to what's going on. But in reality, a lot of the reason why we don't have information is because of the lack of diagnostic capability in many developing countries. So travelers go to these countries and they don't have the ability to be diagnosed. So when they come back, nobody knows whether they've just got a flu or whether they've got some really unusual infection. So I think a big part of the infection control response to emerging infectious diseases, which potentially are hazardous to travelers, is raising the capacity in the host countries. There's a standard travel medicine advice: is you cook it, you peel it, or you leave it. We also tell people to be aware of what's going on. Like, for example, in countries with avian flu outbreaks, they should ideally stay away from live animal markets or from farms. And in general, just simple basic hygiene strategies would probably work. I began my presentation talking about tuberculosis, and tuberculosis is a very old disease, but in recent years there's been the emergence of multi-drug resistant tuberculosis, and there have been cases, not many, in travelers who transmit multi-drug resistant TB. Of course, the big one that everyone's concerned about is influenza.